CBS, I'm Cody Holyoke.
And I'm Liz Bishop. The Compassionate Care Bill was amended, and it was printed overnight, and that means it is eligible for a vote on Thursday, and that's the last day of the legislative session. But it appears not everyone's on board with it.
That's right. It's our top story tonight. Jennifer Lukey joins us live from our Capitol newsroom to fill us in. Hi, Jen.
Good evening, Liz and Cody. Lawmakers worked late into the evening last night, making changes to the Compassionate Care Act, agreeing to some of the recommendations given by the governor. But it appears there are still some major sticking points. The governor said this morning, in its current form, he will not sign this bill, even if it passes in both houses. So the closed-door meetings here continue. And at this point, it's really unclear whether any sort of deal will be reached by Thursday. The current version of the bill would allow patients over the age of 21 to smoke up to 2 ounces of marijuana per 30 days, but not in public. Those under 21 who need it would have to ingest it. The governor and a number of lawmakers say they don't want anyone smoking it.
I think that medical marijuana is appropriate for people that need it, and it can be done. But I don't think anything is gained by smoking of marijuana. Except I think it's hazardous to your health, and I see it as a gateway drug.
I think a lot of it has to do with the heroin crisis that we're having right now. So we're trying to deal with that with this hand. So how do you go and make something like marijuana more available, not have control over it, and not know what you're really getting into?
Under the amended bill, the state health commissioner would be the one to decide which health conditions would be approved or disapproved in the future, and would be in charge of approving marijuana growers, whether inside or outside of the state. Already removed from the list of approved illnesses as a concession in this bill are diabetes, lupus, and post-concussion syndrome. Something not in the bill that many lawmakers and Governor Cuomo were also looking for, a 5-year sunset clause.
My biggest concern is all about control and how we control it, and actually to use it. My point has always been that it should be a sunset provision if we do anything to make sure that we're doing the right thing.
And that decision may or may not be voted on by the end of the week.
We all have an interest in trying to reach a good three-way agreement that can create an airtight system, but also a system that can work for the thousands of New Yorkers who are really suffering and who need our help.
We've made progress in the discussions, but we're not there yet. We have, as you said, 3 days. I said that a bill like the medical marijuana bill, we can do any time up until the legislature leaves. So we have made progress. That's the good news. The bad news is we're not there yet.
It's really become a waiting and a guessing game down here at the Capitol. Most of the lawmakers we spoke with who are not in leadership positions really have absolutely no idea what will happen. We've heard that there will be lobbyists for medical marijuana at the Capitol tomorrow, hoping to encourage a last-minute deal. We, of course, will continue to monitor the situation and bring you any updates as we get them. For now, live in the Capitol newsroom, Jennifer Lukey, CBS 6 News.